everyone. Welcome back to our Feeding Breeders webinar series. My name's Dawn Haig and I'm part of the PIP team. Before we start, I'd like to do a quick poll to check in and see how everything is working for you. The poll will appear on your screen and you can just click on the answer that's most appropriate for you. Great. And as we wait for the responses, I'd like to introduce our moderator today, Tanya Moraes. Tanya is PIP's extension technician. Hi, Tanya.
Hello, everyone.
Okay, so let's see if we have any results now from our poll. Oh, there we go. Thanks, everyone. Okay, very clear results. It's been great. I've watched them all, 71%. That is what we want to hear, everybody. Thank you so much. And it's been great. And I plan to watch the ones I missed, 29%. And other than that, it's not anyone's first one, and it seems to have been great interest to everybody. So that's wonderful news. We really love having that feedback. Thank you. Okay, now I'd like to, before we continue any further, thank our sponsors again. We are so grateful to all of them. Their funding is what has made this event possible for us. Presenting sponsor is Poultry Innovation Partnership and RDAR. Our platinum level sponsors, Aviagen and EW Nutrition. Gold level sponsor, Merck Animal Health. Silver level sponsors, Cargill, Cobb and Boehringer Ingelheim. Bronze level sponsors, New Life Mills, Country Junction Feeds, Canadian Hatching Egg Producers. And supporter level and meal sponsors, Chore Time, Canadian Biosystems Incorporated, Alberta Hatching Egg Producers, Ritchie Smith Feeds, and Alberta Chicken Producers. Thank you again. So today, the question we're going to discuss is, how do gut health and disease influence feeding and efficiency in broiler breeders? We have two wonderful speakers for this topic. Our speakers are Dr. Jenny Nichols, Clinical Associate Professor of Avian Medicine and the Director of the Poultry Diagnostic and Research Center's Diagnostic Lab at the University of Georgia, and Dr. Andre Stange, a practicing poultry vet in Veterinär Centrum Somron. Dr. Nichols will be our first presenter. Welcome.
Thank you, Dawn. You should be able to see the question phrased, how does disease influence feeding and efficiency in broiler breeders? And I would like to say good morning, good afternoon, and good evening to all of those who are joining us from all over the world. I'm going to go camera down here so that you can see most of my slides, because I think my image will cover some of them. So this question is a great question, and I think you'll find that I came at it from a bit of a different angle, in that I actually flipped it on its head and approached it more from the stance of how does feeding and efficiency, and really focused on feeding, influence disease in broiler breeders, specifically metabolic disease. And before I start talking about this, I'm going to back up a little and explain how I came at this approach. And really, it all started with an email. I was included on a thread discussing serum tests for hypocalcemia, serum being a component of blood. And my colleague said, you know, we see a lot of this in broiler breeders, maybe even in pullets, and we have an iStat machine. And my response was, ooh, shiny, that caught my attention. I'd been doing some work with the iStat machine in my former position up at the University of Saskatchewan, and I was really interested to see what we could do with that machine here. Now, some of you in the audience might be going, wait, what is an iStat? And don't worry, I'll explain. Put simply, it's a tool. It's a handheld portable blood analyzer. These tools have been used in human medicine and medical settings for a number of years, and they've been adapted and applied in the veterinary field. Often they're getting used in small animal hospitals, and lately they've made their way into poultry veterinary hands. This machine has different cartridges available, and I can use certain cartridges to measure blood gas, like oxygen and carbon dioxide, or electrolytes, like sodium, chloride, and potassium, other chemistries, and hematology values, like hematocrit, which is a measure of how many red blood cells are in that sample. So it's pretty handy, and it gives me pretty instant results. Now, others in the audience might be going, wait, what is hypocalcemia? And that is simply not enough calcium in the blood. And why are we talking about calcium? Well, it's one of the most abundant minerals in the body. Most of it is found in the skeleton, and the rest is found in fluid throughout the body and within cells. And it's really important for you and I and for birds. It's important not only for bone structure and metabolism, but we need calcium for blood to clot. We need it to activate different enzymes. And it's really important for proper nerve and muscle function. And if you're a chicken laying eggs, for the formation of eggshell. So what about calcium in the pullet? Well, in the pullet, it's really important for bone formation and about 5 to 6 weeks before maturity for the formation of medullary bone. Medullary bone is a readily available source of calcium that hen is going to rely on to produce eggshell at night when she's not eating and getting calcium from the diet. When it comes to calcium in the blood of the chicken, measuring calcium can provide insight into the overall calcium status of the bird. And in the blood, about half of the calcium in the blood is available as ionized calcium. And this is the form that's available for the bird or for you and I to function. It's what we use for nerve and muscle transmission, for blood clotting, and so on. The other half of that calcium is bound up, mostly bound to protein or albumin, and some is complexed with citrate and phosphate. Now, when we feed birds, we have to get calcium from A to B, or from a pan or feeder into the bird, into the blood, and into the bone. And because of this, I asked the question, does how we feed today's modern broiler breeder impact this? And does it play a role in metabolic disease if we see it? So circling back to that email that I mentioned, my colleague talked about hypocalcemia in pullets. And my initial response was, are you sure you don't mean in hens? I mean, I'm more familiar with hypocalcemia in hens. We call this calcium tetany. And I'm referencing an Age in Brief article published back in 2009 here, which is still a great resource full of lots of good information talking about calcium tetany. And so in hens, there are different factors that can increase the risk that a flock might experience calcium tetany, including poor pullet uniformity, coming into production really fast, feeding a high calcium feed before a flock is in egg production, or providing a small particle calcium size. Other factors that are going to impact calcium regulation include changes in blood pH or electrolyte imbalance, intestinal health of the bird, which I'm sure we'll hear about today, which could impact absorption in the first place, or transit time. If things go through too fast, we don't have time to absorb them, the calcium form itself, and then finally heat stress, which feeds back to have an impact on blood pH. And that's what this graphic on the right is showing you. If a bird is hot and pants, they decrease their blood carbon dioxide levels, which has an effect of increasing blood pH and dropping the available calcium in the blood, which then interferes with nerve impulses and results in this presentation of calcium tetany in a hen. These hens may be found down in the scratch area, unable to get back up on the slats, and often they'll have the legs extended behind them and their wings will be drooped and they may or may not be panting. And if you pick these birds up, you'll feel their muscles twitching or jumping under your fingers. So to give you a bit more information on blood pH, I'm just going to talk briefly about blood pH. And it's simply a measure of the amount of hydrogen in the blood. It gets maintained within a relatively narrow range for humans and animals alike. And the reference range for humans is 7.35 to 7.45. For broiler chickens, it's 7.28 to 7.44, and I'm pulling that reference out of this Manual of Poultry Diseases text. And the pH is controlled by the partial pressure of carbon dioxide and by bicarbonate. And so very simply, I'm going to take some of you way back to our high school chemistry class. Don't run away. I promise this will be brief, and I'll reference back to it later in the presentation. But maintaining blood pH is all about maintaining this following equation, which simply describes an interaction between carbon dioxide and water, carbonic acid, and bicarbonate and hydrogen. This portion of this equation is controlled in the lungs. This portion of the equation is controlled in the kidney. So if a bird increases or decreases her breathing rate, we're going to have a respiratory impact on blood pH. And if the bird changes whether she's excreting or retaining bicarbonate or hydrogen in the kidney, this will have a metabolic impact on blood pH. What's important to know about the respiratory changes is that those responses can be quick. They can happen in several hours. But when it comes to the kidney, those responses may take several days. And I'll allude back to this later, but for now, we're going to move on. So back to that email. Hypocalcemia in pullets? Really? Being a healthy skeptic, I grabbed my tools and headed out to some farms to see if we could see this. And lo and behold, we targeted farms around 10 weeks of age, which is when some folks were reporting seeing these signs. And on several of the farms we went to right away, I was able to find birds that were down with their wings drooped and their legs out behind them, twitching. You can see some of the other muscle twitches resulting in the tail feathers move in this bird. All right, well, if it walks like a duck and talks like a duck, it's probably a duck. This certainly does look like hypocalcemia, but in pullets. And the clinical presentation was that we observed this half an hour to an hour after feed went out. Birds appeared weak and paralyzed, their muscles twitched, their wings drooped, they panted, and often they recover about half an hour to an hour later. But in severe cases, some of these hens would die. We only observed this on a feed day, and usually when flocks were between the ages of 7 to 10 weeks. So being prepared, despite my skepticism, I had my tools with me. That first flock we were at was 74 days of age and not reporting any issues. So sometimes that translates to not reporting an increase in mortality. Half an hour after feed was distributed, we found birds that were down, twitching and panting, and decided to sample blood. And here's one of these birds that I'm holding. You can see she's panting, her wings are drooped, and her legs are extended out behind her, and they're twitching. And I'm going to take those blood results and put them in a table and briefly step you through them. So we sampled 5 birds, one of which appeared clinically normal. And I've got some reference ranges for some of these values that I've pulled out of that manual of poultry diseases listed at the bottom, highlighted in yellow. And the one that I want to draw your attention to is ionized calcium. And with the exception of that first bird, which was at the low normal range, all of those birds sampled had ionized calcium that was lower than the reference range I'm using to help guide my interpretation. Now, I'm going to preface this with a bit of a caution. These reference ranges are from broilers, and we don't really have a well-developed set of reference ranges for broiler breeder pullets, let alone birds that are on skip-a-day feed. So I'm interpreting with what I've got available to me, but certainly low ionized calcium would explain these clinical signs, and it makes sense in the context of what I saw. And add to that another value that I'm going to insert in the table, which is potassium. All of these birds, with the exception of our normal looking bird, had high potassium. Interestingly, our normal looking bird also had some of the lowest ionized calcium. And in the context of what I told you about blood pH and panting, this makes sense. This bird has one of the higher blood pHs at 7.44, and her carbon dioxide levels tell me that she's been panting, which is going to drop her overall ionized calcium. So these results, in my opinion, again, make sense, and they explain the signs we see and why some of these birds die. And I'm going to try and elaborate on that a little bit further in this next slide. So I've got that image showing you that if birds pant, it drops their carbon dioxide levels, it increases their blood pH, drops their blood calcium, and messes with their nerve impulses. And that's what this picture here is trying to explain to you. This is showing you how a nerve impulse or an action potential gets generated. And when we have low ionized calcium levels, what that does is takes this normal threshold that a stimulus has to get above in order to generate a nerve impulse, and it drops it. So it makes it a lot easier for nerve impulses to happen. So in a low calcium environment, we're much more at risk of all that muscle trembling. And this is the tetany sort of response that we see. And in birds in production that are experiencing tetany, if I cut into their breast muscle, which is what this image here is showing you, I'll see evidence that this damage has occurred in the form of edema that accumulates between the muscle fibers. And that's what this glossy reflective area is showing you here. And what happens when we start to get muscle damage and this type of thing happening in one of these birds is we're getting cellular damage. Potassium is an electrolyte that's present primarily inside of cells. And when they're damaged, all of a sudden potassium levels start to increase. And the effect that has is to increase the resting potential. Now, all of a sudden, we have a low ionized calcium, high potassium environment, which is a recipe for disaster. And these birds continue to go on a downward spiral where they have these uncontrolled muscle contractions because all of a sudden it doesn't take much of anything to generate a nerve impulse. And we get additional muscle damage, and muscle contractions increase the bird's body temperature, causing her to pant further, causing ionized calcium to go lower, and so on and so forth. All right, so that was one farm. What about other farms? Well, we found a similar picture on a feed day, around 10 weeks of age. birds were clinically affected. And again, not all of the flock, it's a portion of birds, but those birds affected had lower ionized calcium and increased potassium. And as we looked at these results, we started to see that they suggested maybe these birds are too hot most of the time. And could chronic panting, which is going to increase blood pH and happens rapidly, be triggering that bird to try and reduce her blood pH metabolically, which is a slower compensatory mechanism? After all, we know pullets produce more heat on a feed day than on an off feed day on a skip day program. And this is a diagram taken out of an article from the Canadian Journal of Animal Science, and it's also in the second edition of Commercial Poultry Nutrition. Some of Dr. Leeson's students did some work showing that heat production in a skip day fed bird on a feed day is higher, that's the top line, than it is for a skip day feed bird on an off day, the bottom line, relative to birds that are fed every day, which is the middle line on this graph. So I'm going to throw a caution out there in that I know there's a question that we're trying to answer today, and I think I'm going to leave you with more questions than answers. What is going on? Still a good question. And I'm going to add to it. Is this presentation more common than we realize? This bird on the left is one of these tetany birds. She has low ionized calcium and elevated potassium. She's panting. Her legs out behind her, but when I try to encourage her to move, her muscles don't work right and she stumbles. This is a feed day, and that bird, I believe, was 74 days of age, compared to this bird in a similar age range, also on a feed day, also showing signs of respiratory difficulty, but looking different than the bird on the left. She's got a full crop, and if she dies, we're going to attribute her mortality to choke. How many times, I wonder, do we attribute mortality in the bird on the left to choke as well? And what do we do about it? Well, instead of staying on a skip-a-day program, some folks are going to go to a 5-2 or a 4-3, which means more consecutive days of feed, and the problem goes away. It also means more consecutive days of calcium going into that gut, and the problem goes away. And then I'm going to step back and say, are we putting the cart before the horse? Because I've already alluded to this. What is normal? So we set out to try and get some normal. And this is work completed by one of our Master of Avian Medicine students, Dr. Randy Cran, formerly Clark. And our plan that we hatched was to go out and sample 12 farms, representing 4 different companies and 2 different breeds. We planned to sample 12 apparently healthy birds on a feed day and 12 apparently healthy birds on a skip day, for a total of 288 birds sampled. We targeted flocks between the ages of 65 and 75 days, so right around that 10-week mark when these signs were being observed. And basically, an hour after lights went on, we went out and pulled blood samples. They're collected into these lithium heparin tubes to prevent the blood from clotting, and then they're run on this cartridge in the iStat machine that gives us pH, carbon dioxide, bicarbonate, and ionized calcium levels, amongst others. And we put all of that data into a table to take a look at. And here are our results. The first thing that I'll draw your attention to is that when it came to breed, there were no statistically significant differences in any of these values. But when it came to a skip day versus a feed day, 11 out of 13 of these parameters had statistically significant differences. Now, differences in some of these values make sense and I can explain them, and in others, I don't have a great explanation. But we'll start with some of the ones I can explain. Hematocrit, for example, is something that differed, and it was higher on a feed day. Now, the companies we worked with and collected these samples from practice water restriction on off days. So on the morning of that feed day, that's the longest point that flock had gone with a period of water restriction, and our hematocrit is elevated. So there's more red blood cells in that sample volume, and that's probably representative of the fact that that bird hasn't had as much water on the skip day relative to a feed day. Sodium, or salt, reflects a similar change. It's higher on that feed day, and this again likely represents the hydration status of that bird from the previous day's water restriction. Potassium, which I've told you is high inside of the cells and not outside, stays relatively the same. And this makes sense in my opinion, because as long as I've done great sample handling and I haven't accidentally sampled birds that are clinically affected, we shouldn't have any cellular damage, and potassium should hold constant. Glucose is higher on the morning of a feed day, and that makes sense. The birds have just gotten some feed into their gut, and their blood glucose levels should be starting to increase. And birds, to begin with, are normally or naturally hyperglycemic. They have high blood glucose levels, usually above 200 milligrams per deciliter. So both of these values are relatively normal looking and make sense in the context of our sampling. I think the most interesting value is our ionized calcium levels. Statistically significantly different between a skip day and a feed day, and both of these numbers are lower than that reference range that I've taken out of the Manual of Poultry Diseases text. And I started to wonder, am I getting normal abnormals? Is this what we get on skip-a-day feed programs? And is it truly normal? And so, as I've alluded to, we've got statistically significant differences on feed days versus off days. And I've got more questions for you than answers, including, are these normal abnormals? Are they reflective of our breeder management practices and skip-a-day feeding? What would they look like for everyday fed breeders? I think there's more work to be done, and we still need to capture additional information. Total calcium, for example, or phosphorus levels might be interesting. Are we feeding phytase to these birds, and does that impact the calcium metabolism as well? And at the end of it all, I still come back to this question. Are our skip-a-day feeding practices impacting bone formation in pullets? After all, on a feed day, birds should be depositing calcium into the bone. But on an off-feed day where they're not getting calcium from dietary sources, they should be resorbing calcium from bone. And I think this question has in part been answered by some recent work that was presented in a poster by Dr. Gina Wilson's student, Louise Avila, which shows that in skip-a-day fed birds, whole body bone density in those skip-day fed birds is lower than that of everyday fed birds, and statistically significantly different at some of those sampling points. And that leads me to say, could this also play a role in the susceptibility to Staphylococcus aureus infections that we see in broiler breeders, if our bone formation is happening in this fashion? And with that, again, I warned you I'd leave you with more questions than answers, and I think there's more work to be done. And I look forward to answering questions at the end of this webinar session. And I believe it's time to move on to our next speaker, Dr. Andre Stinkjes.
Good afternoon, everybody. I hope you can hear me well. And thank you, Jenny, for your presentation. And thanks to the organization for being invited to do this presentation. I was asked by Rick van Eemhuis, who also did a presentation, Rick van Eemhuis from Wageningen University. And he convinced me that I should tell something from 30 years, more than 30 years in the practice. So this will be in contradictory to the presentation of Professor Nichols. This will be a very practical one, and honestly speaking, with no scientific discussion. It's good to know that I'm a field practitioner in a veterinary practice. You see it on the left, in the left logo. We are a multi-species practice, and I'm one of the 5 veterinarians in the poultry team of our practice. Besides me is sitting a young colleague who is very helpful. I'm very grateful to him, Luc Snoeyen, who is very helpful in helping me with this presentation being all right. Our team is furthermore with 2 assistants and 7 people in the lab. Good to know that we are having our practice in a very poultry dense area, and I will tell something afterwards. I have a lot to tell from these 30 years, and especially from diseases in broiler breeders. The next. Okay. And if we talk about diseases in broiler breeders, about gut health and diseases of the gut, we have many. And if I divide them in non-infectious, you for sure will recognize some of them. I will concentrate on the infectious ones, and I will finish with a special case report from the past, but which was very interesting, and we've learned a lot from it. I would like also to emphasize that one of the main things that is giving us sometimes problems is water quality. We may not forget that it is possibly the most impossible ingredient of feeding our broiler breeders, especially pullets. Talking about infectious causes, I would divide them in viral, bacterial, and parasitic infections. And for sure, you know some of them very well. I will tell something specifically afterwards about it. I'm talking about the Dutch situation. The Netherlands has a very strict production cycle of parent stock flocks with a rearing period of about 20 weeks. Then birds are transported to the production farm for the next period in which they produce their hatching eggs. In the past, some farms did rearing on the same place as production. We know from benefits, it's less disease susceptible. Not having a transport is for getting diseases better, but we know that when you separate ages, you also have the benefit that there will be no possibility of sharing infections from one to the other age on the same farm. The first days of the chick's life are very, very sensitive, especially the first 5 days. And I would emphasize this with the things mentioned here. You're depending on very good biosecurity, very good cleaning and disinfection. You have to be sure that maternal immunity is in order, that they will not be infected very early, that they have possibility to build up their own active immunity in the time that maternal immunity is decreasing. You have to be aware that vertical transmission is possible, and especially in poultry dense areas, there is also the possibility of having very early in life horizontal transmission. And just to emphasize this, this is the region where our practice is positioned. Our practice is here with the red star. I have to apologize for the Dutch terms in the legenda. I can translate some terms because the light blue spots are the rearing broiler breeders, the light blue spots. You see a lot of them around our practice. And honestly speaking, they are in the neighborhood of a lot of other categories. For instance, the green ones, the light green ones, they are layer farms. And also the broiler farms, which are pink spotted. And we know from one farm specifically, which had every time early infections with IB. And especially IB in the early life can have the consequence of false layer flocks. But you can imagine also that these flocks are infected very early with, for instance, reoviruses or Marek viruses, which will harm gut health and for sure also general health. So be aware in our region where we have young flocks between older flocks, layers, turkeys, broiler breeders, for sure there will be horizontal spreading diseases. Royal GD, the Animal Health Service in Deventer, has developed a perfect test called the VIR-check, in which they check for early infections, and also you can find out whether your cleaning and disinfectious procedures were all right. You can imagine that if you find already on day 6 or day 7 these viruses, they normally are still present when these chicks arrived, were present when these chicks arrived on the farms. We take 10 cloaca swabs from every house, check them for these viruses, also to make sure that these viruses were not present when the chicks arrived. And it's good to know that already in a trial, they even found out that when you compare very biosecure farms, especially broiler farms, that the growth in the perfectly disinfected farms, so with a very good score in this VIRCHEC, is 100 grams higher than the poorly disinfected farms. We still see some of these farms, so they have a lot of work to do to improve. And when we compare these VIRCHECs from broiler breeder rearing farms to broiler farms, also from our rearing farms, we know that they are better. Good to know this from the Dutch situation. Another moment that is giving troubles and that is challenging in the rearing period is around vaccination, selection and handling moments. We have very intensive vaccination schedules in which we have 2 moments where the pullets are injected. So you have to take them in cages and give them several injections or eye drops or wing web injections. You can imagine that these are stress moments, and we know from these moments that birds are stressed. And we see also in some flocks that there is a problem to let them grow in this period. Then the disease with a very big impact on gut health. And up to me, this is the most severe possibility, especially what you see here, the inflammation on the right side from an Eimeria Necrotic infection with hemorrhages inside the gut. This will harm your flock uniformity. You can imagine these birds will not eat. Sometimes birds are so sick, and they are shown here on the picture in the post-mortem room, that they even drink from our medicines. So sometimes we have to decide to inject them, for instance, with sulfa and possibly combined with penicillin preparates. It's off-label use, but just to save as many birds as possible, because they don't drink anymore. And what a difference between a healthy gut, which you see here on the left under picture, compared to the diseased gut. Every type of Eimeria species causing coccidiosis has its special location. As you see here in this picture, compared the typical broiler types to pullet types, of which the Eimeria Necrotic and Brunetti sometimes are very severe. I think that Eimeria Necrotic is causing the biggest mortalities and has also the biggest impact on flock uniformity in our situation. A. sevellina maxima and tenella are sometimes seen, but Necrotic, Brunetti more often, and especially if we have a failure in our vaccination. And what I have stated here, coccidiosis vaccination changed the world. I remember the introduction in the 90s, and it really changed the world also for a veterinarian, because in the past we used to treat a lot of flocks, and sometimes we were surprised about mortality, that on one day in a flock of 10,000 birds, you had a mortality of a few birds, and the next day already hundreds and sometimes 1,000 birds. And after coccidiosis, this totally changed. But vaccination needs to be very precise. We have several methods for vaccination, and preferably, I would say, we would like to do it ourselves on the farms, controlled, and especially being aware that if you do this in nipple liners or in cup liners, that possibly if you have a smooth water flow, the oocysts that you want to vaccinate go downwards and don't reach inside the bird. It's a very precise work, and we know that if we follow certain procedures, it's getting better on farms who have these problems, and we really can prevent for outbreaks. But mistakes still take place. I know from the past from one farmer who had several outbreaks in consequent following flocks. And his mistake was that he ordered for a very good pellet because this was also used in broilers. And when we found out that he asked for broiler feed, broiler pellets with coccidiostats, we understood what happened. He spoiled his vaccination with the drug inside his feed, which he was not aware of. And the world changed also for him when this was corrected. Another agent that is very challenging for us is Clostridium perfringens. We know it from necrotic enteritis with this specific post-mortem picture of a diphtheroid membrane, which easily can mix up with Brunetti infection because they look the same, and you really need microscopic examination to find out whether it is only Clostridium, which can be proven by your gram staining in the lab or by microscope with Brunetti check. And sometimes we see Clostridium also in combination with Necrotic coccidiosis, especially during rear, but sometimes we see this also at the onset of production when the birds are very sensitive. Well, the clinical signs of Clostridium can look the same like from other diseases, but the picture on postmortem is very specific. And if you do this staining in the lab, you will find out that you have a very typical picture with this typical stained Clostridium bacteria. We know from Clostridium that they have certain ways of pathogenesis shown here in the picture. They produce, like other Clostridia, like botulism Clostridia, bacteriocins, and also we know that virulent strains can secrete enzymes that break down even tissues around the gut. With a subclinical form and an acute form, and I remember from rearing birds that they can have very severe losses, but it's very favorite disease for veterinarians because you can easily treat with penicillin or amoxicillin, and this will really change the picture. Another typical disease for us is when we have dysbacteriosis, when changes happen and where when your microbiota is changing. For instance, when there is a change in digestion, there is more substrate for bacteria and resulting in more bacteria in parts of the gut, causing dysbacteriosis. With also this typical picture with pasty vents and with the consequences for FCR and colonization of a lot of Clostridia, higher and higher in the gastrointestinal tract. Something else, and for me this is one of the big miracles of biology, that every chick, but also every human being, is carrying a lot of bacteria inside. I've been told that human beings carry almost 2 kilograms of bacteria with nothing happening inside normally. If you wound yourself falling from a bike, or if you cut yourself, your skin with a knife, it can be inflamed when infected. But we know that every day we carry in our intestinal tract a lot of bacteria, good bacteria, necessary bacteria, but they also can leak towards the bloodstream. translocation in a compromised gut shown in this picture. And if they go to the blood vessel, and when you have a bacterium, the world changes, also in birds. And one of the things that we more often see happen, more often than when I started in the practice, is that we see enterococci problems from this leakage. We assume that it's leakage via the gut. We sometimes see it, especially from Enterococcus hirae, I know this, but also from Secorum, when we treat with antibiotics, for instance, against E. coli problems in the first days of life. And we see after a few weeks, more often Enterococci outbreaks. Okay, it's not very severe, but we lose a lot of birds. Very specific is the valvular endocarditis from Enterococcus hirae. And we know all the kinky back problems from Enterococcus secorum, with sometimes very specific problems inside the vertebrae, as shown the comparison here between the left and the right side. You see the abscess in the vertebrae. And this is pressing on the nervous system, like a hernia is pressing. These birds get lame. And honestly speaking, we see this more often than, for instance, in the 90s. And I saw this article, it's from 2001, if I'm right, or it can be 7 in World Poultry, that we are not the only ones seeing this, here called an emerging disease in broiler breeders. Another emerging or possibly re-emerging disease in broiler breeders, which compared to the 90s is now more often seen and is giving us more and more questions. How can this be explained, but also how can we prevent this, is Histomonas, with very specific pictures, like on the left. It's a picture that we see more often in younger birds. I think the youngest birds that we have seen with this picture are over 10 weeks. We never see it before. This also gives the question, could it be horizontally or also vertically introduced? It's the good question, but I don't believe in vertically. But the right picture is showing the typhlitis with the contents, we call them scibillae, fibrinous content, which we also see in the older birds. And we see it sometimes in a few birds, but if we see this at the beginning of the production, we lose a lot of birds, we think from leakage through the gut barrier because of E. coli peritonitis. It's a difficult thing. We didn't see this in the 90s, but since the ban of the veterinary drugs, even in feed in turkeys, we have a lot of problems seen in turkeys, but also they are emerging in broiler breeders. And the routes of transmission are also giving questions. We know that it can be introduced by the vector, the intermediate vector Heterococcus gallinarum, but also earthworms can be the host and be a part of the cycle. One researcher of Deventer, Will Landman, I want to mention his name, he's well known and a good scientist. He really told me that it can start with introducing an earthworm carrying this Histomonas parasite. Only one worm can be responsible for a disaster in your flock. So how to prevent for introduction of earthworms and also Heterococcus. And if we know that that you may assume that the several stages of this parasite are very sensitive, you may ask, but how can they survive? If you get rid of worms, if you get rid of worm eggs, you can prevent for Histomonas, but it's an easier said than done thing. And what we know from turkeys, that even without the presence of a vector, they can occur. Then the last part of infectious diseases are the worms. We have 3 types in our country in PS, and we see them rarely in rearing farms, but we see them, but mostly on the production farms. And I think especially the tapeworm has been underestimated. There was a period in which darkling beetles were seen as the big antigen, the big competitor from the red mites. People really tackled red mites infection. They thought by darkling beetles being present, they didn't treat darkling beetles, and we know that darkling beetles can be the vector of tapeworms. So possibly we have improved, have make bigger the tapeworm presence because of not treating for darkling beetles. Roundworms are often present on our farms. I think a lot of farms know this type of worm, and the roundworm is seen very rarely, but sometimes is. They have the specific picture, possibly you know them, also their position in the gut. We see the Heterococcus gallinarum in the top of the ceca, and be aware that we treat these days our Heterococcus gallinarum more often, almost all cases, because we fear for the introduction of histomonas. Then in general, because talking about the consequences for feeding and efficiency, in general, when we have these intestinal diseases, you see that birds lose appetite. You will get uneven growth and therefore decrease of uniformity. Your peak production will be lower and later, and for sure the feed conversion will be worse. Because of a poor digestion, we get wet litter, which is also a non-wished situation. We want to have a good litter because of food pot dermatitis and food pot lesions. In some cases, like Clostridium, like histomonas, and especially in the Necrotic Coccidiosis, we have an increase of mortality, and which is not mentioned here, but I know this for sure, that in some kind of disease, in special cases, we get complaints from the hatchery. The offspring is worse. Sometimes hatchability, sometimes fertility is getting lower. And for instance, what we didn't know, some flocks with severe histomonas get complaints from the hatchery about hatchability and chick quality. Then a case report also about disease in broiler breeders, but then from a source being the feed, and possibly immediately recognize what is happening. In broiler breeders, we saw in our practice in 1 week several problems with production. In one flock, especially 35 weeks old, they lost production slowly. They got poor eggshell quality, more second choice eggs, as we call them, no floor eggs, and they were too quiet. And what I realized myself when this guy phoned to the practice about his problems, that we had forgotten him to inform him about problems that were taking place. Because what happened those weeks before, we found out that there was a premix factory delivering premixes to several companies, feed companies, which had forgotten, there was a mistake during holidays to put in vitamin D, cholecalciferol. And the problem on layer farms were recognized immediately because they got lameness and also poor production. But this guy with these broiler breeders had via an intermediate factory his feed, and we forgot him to inform. Everybody forgot him. He didn't get the vitamin D supply. And what we found out after weeks, the hatchery had very poor hatchability, and there was one day in which they opened the hatching room and they didn't see any living chicks with very typical picture in embryos. This guy, he conserved his feed samples from every delivery. So the insurance company had a really convincing story. He got as first person his insurance payment because it was so clear that feed was the problem. But it had costed a few weeks, I think 3 or 4 weeks, before the first signs were present. But in that period, produced hatching eggs, didn't produce any embryos, any vital chicks, because they were not able to come out of the eggs. These pictures are so clear that you can bend their beaks, so soft were they, because of a lack of vitamin D in the parent feed. This is my presentation from the Dutch situation. I hope I have not taken too long. I think it's more than 20 minutes. Thank you very much for your attention.
Thank you, Dr. Andre and Dr. Jenny. It was very interesting presentations. I've learned a lot with both your presentations. If you have any questions, please add them to the Q&A box. We still have about 8 minutes for questions. I've got a question here for Dr. Jenny. What were the body weights of the birds affected by calcium tetany compared to the target body weight for their age?
That is a very good question. We didn't weigh, or we didn't take weights of birds while we were out there in the field taking those samples. It would be worth going back if we repeated this work. We targeted healthy flocks for our normal values. That said, in the context of what we were sampling that showed clinical signs, and it's subjective, those birds did not appear to be over or under representative of the average in the flock.
Thank you. Dr. Andre, you mentioned that poor digestion can generate more substrate for bacteria. In your experience, is there a feed form or a feeding schedule that would be detrimental for digestion and favorable to diseases?
Sorry, I didn't understand well, sorry.
Well, you mentioned in your presentation that if the bird has a poor digestion, then there's a more environment for bacteria is better. Is there a feeding schedule or a feeding form that would be detrimental to digestion and then cause more gut health problems?
Oh, that's a very good question and difficult to answer. In general, I think that a disturbance inside the gut, that can be any disease. And if you ask me a special formulation, yes, for sure, if mistakes are made, but it's very difficult to say what would be wrong in the feed, but we know from the past that some formulations which had gone wrong caused this problem, yes. But any disease can cause this poor digestion. Yeah, by the way, I understood that Professor Nichols spoke about this, that you sometimes feed skip a day. We are not allowed to feed skip a day. And honestly speaking, it also solved some problems in our disease situation. But we are not allowed to do so. And honestly speaking, by giving them everyday feed, we also have seen less problems with diseases.
Very interesting. So can you say, based on your experience, that can be for both Dr. Jenny or Dr. Andre, that skip a day feeding can cause damage to the gut? Like increase the rate of passage or make something abnormal in the gut that damages and makes it more susceptible to diseases?
If I may be the first, sorry, Professor Nichols, that I take the word first, but it just my experience that since we have changed to everyday feeding, it seems, it's not hardly proven, that on a lot of farms, things seem to work easier. And the farmers explained to me that they think that they are less stressed, but that is easier said than proven, because in the past, when we were focusing on flock uniformity, we choose ourselves, honestly speaking, for skip a day or skip another day feeding.
Yeah, from a uniformity perspective, the skip a day feeding program is very helpful. From a disease perspective, especially timing of skip a day. So with our coccidiosis vaccinated flocks, the time that skip a day feeding gets implemented, for example, if birds are truly into a skip day program where they going a day without feed, that usually falls around that 4-week of age mark. And if coccidiosis vaccination hasn't been applied evenly, or if there's been other challenges, that's usually a point in time where they're peaking in coccidial cycling. And then all of a sudden you pull feed away from them and they work the litter more, they increase exposure. It sets up for a gut disruption. It's kind of a perfect storm when you stack different stressors like that up. So certainly skip a day, I believe, can play a role. It also is all about how it's managed. And then at the end of the day, those cells that are lining the gut need nutrition as well. And we take that away from them on a day. And so that ultimately, it's not, I haven't got a scientific example for it, but that's ultimately going to have an effect on the ability of that gut to withstand disease or defend against disease.
That's very interesting. I know that uniformity is key, right? It's very important, but then if you have a problem in the gut, then you're gonna cause other problems and even affect uniformity. So I think gut health should come before uniformity, because with bad gut health might lead to problems with health and uniformity.
And,
Doctor,
and disease will ultimately negatively impact uniformity.
Yes, that's true. So one thing that I'm still trying to understand about the calcium pathogeny, is there not enough calcium being consumed by the birds that are observed, or is it more a problem with calcium absorption, like a faster rate of passage in the gut, or not a right particle size of calcium? Would be more the quantity of the calcium, or the calcium not being absorbed by the gut?
I have some of the same questions that you have. Is it not enough calcium? Are we feeding phytase enzymes where phosphorus is impacting the calcium that gets absorbed? Is it relative? Is it absolute? Is it the fact that they get calcium in the diet and they don't have particle size that allows them to retain calcium in the gizzard long enough that they have a source on the off-feed day? I have a number of questions as well that I don't necessarily have the answer to. And I think that's where it could be really important to use this information in our data to work with our nutritional colleagues to try and understand what's happening here, and are there things we could do to help moderate what we're seeing.
Thank you.
You're welcome.
Dr. Andre, what are your thoughts about the effect of gut health later in life due to delayed in feeding of the breeder chicks when they're in their transportation from the hatchery to the farm?
Sorry, again, I have to ask to repeat, because you're speaking very well English, better than I can understand. Can you repeat the question, please?
So what are your thoughts about the effect on gut health later in life due to the delayed feeding of breeder chicks after they hatch?
If I understand the question right, what the possible negative effect can be of a delayed feeding when you transport chicks from the hatchery to the farm.
Yes, because it takes them a couple of hours to have access to feed.
Yeah.
So that has been studied a lot in broilers, but there's not much in breeders, like in their immunity and their gut health later in life. Could you
Yeah.
like extrapolate on that? What are your opinion about?
Well, it's a very, very actual question also in the EU. When I speak with my colleagues from other countries, I know that this is really a topic at the moment. Possibly the question is therefrom asked. Well, honestly speaking, I am born on a poultry farm. My father was a farm manager of a breeding company. So I already was educated that birds can be flown to another part of the world and that they can, without 2 or 3 days without feed or water supply, having a yolk sac, had to survive. And honestly speaking, it's my opinion that they can survive. But now the but. We know from the Dutch situation at the moment with broilers that if they are hatched inside the houses, for instance, we are veterinarian on a patio farm, where the eggs are hatched inside the patio system, that if they are hatched well, brought to the house, the problems are very small about mortality, leg problems, and possibly this has to do something with the way that after being after coming out of the egg, after being hatched inside the house, they immediately find water and feed. And I know that some people in Holland think, because it's more often done, hatching eggs inside the house, that some people think that gut integrity is improved by this. But on the other side, I know also from flocks that are transported all over the world during 2 or 3 days without any problems. So it's difficult to answer that it is necessary to give them earlier feed, but I know from the Dutch broiler situation that on some farms it's working, that they are hatched inside the house and find their feed immediately after being hatched.
Thank you. So if you still have more questions, please add them to the Q&A. We are a little past our time. I have one more question here for Dr. Jenny. So Dr. Jenny, if producers start noticing a pullet with some signs of possible calcium deficiency, what can they do to help those birds and prevent that they die or have further problems?
That's a great question. Those birds are often panting and they're often hot to the touch. So cooling that bird down can play a role. And one of the things I didn't mention, but that's something that some of our producers here have done, is if they see this, and if they have growers that are willing and capable of doing it, they will come in and they will run more fans on a feed day to try and provide more cooling for those birds. So cooling that bird down can have a really beneficial effect on slowing that process. And then the other thing we've done, this would not be practical on a out in the field basis, but is we've come in and we've administered calcium to those birds. So giving intravenous calcium to one of those birds, they pop back up. It's the analogy we use is, if for veterinarians out there, it's like the milk fever cow. The vet comes out and gives her calcium and she pops right back up again. These birds do the same thing. So it might be possible. I don't know if you can supplement or provide individual birds with grit, but that would be something else worth considering. And it's a question I have: could we provide some form of calcium to these birds on an off day that would help to this, if we're continuing in the present time to manage with skip day, while we look for ways that we can effectively move to every day?
Thank you very much. Our time is over and I don't see any more questions coming. So thank you very much, Dr. Jenny and Dr. Andre. And thank you everyone for joining us today. And I'll see you next Thursday with our last webinar. How do we get the right amount of feed to the right breeder at the right time? Thank you again and have a great day. Bye.